Good afternoon. My name is Casey Vermillion, and I'm from Ask Resource Center, and I will be hosting this webinar. Before we begin this webinar, finishing out our monthly focus on early childhood, I'd like to take a moment to share about Ask Resource Center. Ask is a family-focused nonprofit organization whose mission is to empower the families of people with disabilities. We provide individualized support, collaborative advocacy, training, resources, and leadership development for Iowa families of children with disabilities or special health care needs, ages birth through 26, and the professionals who serve them. We thank you for joining us today for the webinar titled Moving from Early Access, or an IFSP, to Early Childhood Special Education, or ECSE. Our presenters are Dee Waddell and Betsy Lin with the Iowa Department of Education. The Ask Resource Center is glad to welcome our presenters, Betsy Lin and Dee Waddell.
Okay, well, I will introduce myself first, and then I will turn it over to Betsy and let her introduce before we start sharing our screen. I am Dee Waddell, and as Casey said, I am with the Iowa Department of Education and work on the state early access team, and I'm part of the Department of Education as the coordinator for our early access services.
Hello, everybody. My name is Betsy Lin. I work with Dee at the Iowa Department of Education. I am an administrative consultant for special education, so services ranging from ages 3 to 21. However, my background and passion is early childhood special education, and previously worked with Dee for many years on early childhood special education and helping support that transition as children and families move from early access into that special education realm. So we are both very happy to be with you all here today.
Looks like you're muted, Dee.
You're muted, Dee.
All right, can you see my screen okay?
Yep.
Okay, super. Well, we'll go ahead and get started then. Thank you. So today we're really going to talk about moving from our early access services to special education. And so we're going to start by going into what are we going to talk about today? Part of our conversation is truly to explore the differences between Iowa's early access and early childhood special education services. We're going to talk about possible pathways when children and families exit early access, as well as then hopefully you'll be gaining a knowledge about the child find process used to determine a child's eligibility and need for special education services. So I wanted to do just a quick primer of our Iowa's IDEA, or Individuals with Disabilities Education Act, Part C. The system of early intervention is an interagency system in Iowa, and it's a partnership between three state interagency agency collaborative partners. The Department of Education is the lead agency in Iowa, and then we have a memorandum of agreement and understanding between the Departments of Education with Department of Health and Human Services and Child Health Specialty Clinics. So those are our partners in Iowa. Early access does have a council, so if you're interested ever in participating in a council, Iowa Council for Early Access involves families as well as public and private providers that contribute to the quality of early intervention services. The other part I wanted to mention is that there's also a representative that really is involved with and speaks to special education, the IDEA Part B, or 619, sometimes it's referred to. But those early childhood special ed services are also represented as a part of our council. The conversation we're going to have today, we'll talk about eligibility for early access. And in IDEA, there is a distinction between eligibility for early intervention and eligibility for special education. In Iowa, we define eligibility for early access as a child birth to 3 who has a developmental delay. And how that's defined is a child who has a 25% or more developmental delay in any one of the areas of their development, or they have a diagnosed condition known to cause a delay. Our early intervention services are provided by our early access grantees are the area education agencies who provide services, as well as we have a partnership with child health specialty clinics to provide those services as well. Okay. What I wanted to emphasize here is that the early access services, we have a long-standing history of providing our early intervention services in what we refer to as a family-guided, routine-based intervention approach. And how we go about doing that is we are providing services to help families, to help their infants and toddlers to grow and learn. The beginning part of that is we develop an individualized family service plan. And so the family service plan is truly built upon the family's resources and priorities and concerns. So, as a part of our development of an individualized family service plan or an IFSP, we provide an opportunity to talk with families through a family directed interview to gain information from the families about what do they see as their concerns, their priorities, and what is their focus for services to so that they know that we are really in working with them to build their capacity to meet their children's needs. Then the other context of our conversation is we provide services in what we refer to as natural environments. We want to provide those services where you would find a typical infant, toddler, and their families. So we provide those primarily in the home and community settings. So that is one thing we talk about with the families of how do we provide those in daily routines and natural settings. The other aspect that's a little bit unique to IDEA Part C is that service coordination is one of the services that is required for all families to have a go-to person, a service coordinator. And that person is the person who the families can go to and help support them in understanding the system, understanding services, understanding their procedural safeguards and their rights, as well as assisting families that to gain not only early intervention services, they also support families in gaining other services that might be available in the community or in a health provider um, agency or organization in their community. We also have a established system to support, and this is what we'll be spending most of our time today is talking about transition planning. So we want to make sure that families and children have a seamless transition when they leave early access or they exit early access services, which would be at 3. Okay. Transition services, transition in general, um, is worth spending a moment and pausing on what does that mean. Transition is truly an event or an activity. It's a process associated with change. And we all deal with change differently. It could be a change in environment, it could be a change in programs. And so in the early years, we really want to try to support families as we prepare not only the child and the family, but everyone for a difference in services. And so I listed here, Betsy and I listed 4 different resources that really talk about that change and that transition. The first one, the Early Access Transition Toolbox, is one that Iowa has developed to support this change in services from early access to special education or other services, and we'd be talking about that today. We also have a professional organization, the Division for Early Childhood, that has really talked about what does this transition look like, and so provided our field of early intervention and early childhood special education some guiding practices, and so that's a resource as well. We talk about changes within the context of Head Start, as well as our another professional organization, the National Association for Education of Young Children, which is an early childhood professional organization. So we wanted to share with you that while we're talking about this within the context of early access to special education, there are lots of resources to support our families. So the next slide is truly transition planning is really getting ready to turn 3. And while this looks linear right here, we will talk about this in regards to what are our requirements for early access as well as special education at different points in time at a child's age. So we'll step through each of these different age bands as we go through, but just wanted to kind of give a visual of, we start when the children are very young. They're toddlers, and then we see them growing into 3 when they turn 3. So the first step in our transition planning is we wanted to show you kind of the overall big picture. Here's a flow chart with the end in mind, thinking about what do we want to do to ensure that there's a smooth and seamless transition for that child and that family. So we're going to go through this step by step. So first of all, as I said, we're getting ready when the child turns between 2 years, 3 months, 2 years, 6 months. We start beginning the transition planning process. The service coordinator is typically the person who introduces this concept of or context of we're getting ready for a transition. Let's talk about what that means. It's everyone starting to prepare and think about what decisions are ahead of us. So we talk about the child's capabilities, their child's interests. What does the child need and do that we might need to think about? We also have an opportunity to share, families share their emotions, their worries, their hopes, their dreams, be able to start to ask those questions to be able to think about what might be next. The other point that happens really when we begin transition planning is to discuss a variety of different services, a variety of different options that may be needed or wanted by the family after that child exits early access. So that is the beginning phases of that transition planning process. What comes next then, we start transition planning. So it becomes a little bit more formal, such as like when you're coming into developing an individualized family service plan, transition planning at this point becomes a little bit more formal. What we start to discuss then at this point, and that happens somewhere between 2 years, 7 months up to and no later than 2 years, 9 months, is we start talking about the possibilities in a little bit more refined way. We talk about the child's skills in regards to, do we feel as an IFSP team, families being included in that team, is the child potentially eligible for special education services? Do we feel like, based on the child's development or based on the diagnosis of what I talked about, that known condition, based on their progress and what other children typically are doing around that age, and then the interventions that we've provided in early access, do we feel like there's a need for that ongoing support? If any of those questions are answered in that context of, yes, we feel like there's a concern, we feel like there's a potentially a need for that special education services, then we want to involve those experts. We want to involve the special education team as a part of that conversation. However, that's not done unless the family says, we approve. We want that, we want to have that special education staff person come and talk with us about that pathway, that potential. So if that family says, yes, let's move in that direction, we set up a transition planning meeting. And that usually happens in conjunction with a formal individualized family service planning meeting. It could be an annual review, it could be a periodic review, but this is an opportunity for everyone to get together and talk about what's our path. So in that context, in that meeting, the conclusion of that meeting will really be, what pathway are we going? Which direction are we heading, at least at this time? So in that regard, we talk about, we want to make sure that everyone, family and the providers, we all understand the community programs that might be available for children when they turn 3. We want to have an opportunity, depending on those answers that we had talked about in our planning process, we want to make sure we understand the special education child find process and the services for when children turn 3. So we're in the planning meeting, we're gathering that information so that we can make informed decisions and develop that plan for what happens next. So this was the formal, like I said, that you're becoming more formal, you're trying to write some things down. This is a snip from Achieve in a document that you would receive as a family member that the IFSP teams are putting together that says, okay, here is our information that we've shared about our child's progress, our strengths, our abilities as that child's skill sets. We've talked about our family's priorities, and then this is what might be next. This is at least the context of we've discussed this as a team, and here's the journey that we may take, the next pathway. So in that transition path, there are potentially two paths that could happen. One is the transition path and the planning process could involve an evaluation for special education, or it could involve a transition to other services and supports and services within the community, not involving special education. So I wanted to share with you kind of that context of transitioning to other services and supports, and then I'll hand it over to Betsy to talk about more so that transition pathway to special education. As I said, this transition planning process, now we're kind of in that stage of there's 3 months potentially left before that child's third birthday. So we sometimes refer to that as 90 days before the child turns 3. Here's what might be happening. So we may start to implement those steps and activities that we have on the transition plan to support the family in those changes for services. It might include collaboration with community providers in early childhood programs to begin new services. Maybe a child hasn't entered into any of those early childhood programs in the community, and so we're exploring that. It may be coordination with programs that they already provide support. So maybe a child goes to childcare, we're just continuing childcare. Those might be some things we would talk about in the transition planning process, as well as then that preparation for exiting of services. In the conclusion, when the child gets closer to that third birth date, we will then talk as an IFSP team with the family included to talk about summarizing that child's abilities and progress in our early childhood outcome areas. So we'll be talking about that as the child begins to exit our services. So here are some of those things that might be done to prepare for the family for that next setting. We may, again, in this context of transitioning to other services, we may select some community programs that we want to explore. That might be Head Start, that might be preschool, that might be other kinds of childcare arrangements. We would then be signing consents so that we could share that information with other programs and talking with the family about those services. Okay. So now I'm going to hand it over to Betsy to talk about moving into a pathway of special education. Betsy, I'll
Great.
mute and turn it over.
Yep, and actually, Dee, I think the next two slides still show a couple of Achieve snippets of what that looks like with those activities. So do you want to talk a little bit more, since that
Sure.
is kind of on that IFSP side of
Okay,
things,
sure.
about those two? Yeah.
Yes. So as we are talking about that transition to special education, then we talk about the meetings that maybe would be held with special education staff as they start that evaluation process, or they start talking about a child's need for special education and what we sometimes refer to that as a child find process. So we would document this in the family plan that these are the things we're going to do. We're going to, and you can see like who is responsible for that. So maybe we'd be setting up a special education meeting, and then we potentially would be talking about with the family different environments that services are provided within special education. So these are individualized. This would be not something that every family would need or have to have on their activity plan or their transition plan. It's those that maybe the family has said, I really want to talk about this. And so that's documented in the plan for their family. The other is we want to prepare the child. The child's going through a transition as well. We prepare the child whether the child is transitioning to special education or into other services. And so I just created one slide here of what might we do. And the family may say, we really feel like we need to have other opportunities for this child to be around other children to see what do they do when they're around other children, if that be the case. Or families might be concerned about the child's self-help skills, or their dressing or their eating skills, and so that might be something that they're concerned about and want to have that as a part of the plan as well. Okay.
Right.
Okay.
Okay. So as Dee mentioned, when you get to that step 4, there's kind of those 2 paths that you might be going down. And one of the paths is that evaluation for special education. So again, if the team has come together and said, yes, we think that this child is potentially eligible to receive special education services when they turn 3, and the family has agreed to involve that team that kind of represents that special education 3 to 21 process, then the team's going to come together and start what we call the child find process to determine if the child is indeed eligible for special education services and supports once exiting early access. And there is a link here to kind of that big picture of what is special education? How do I become eligible for that? What does that look like? And we'll talk a little bit about that. The important thing here is with this process, it's important that it's done and completed prior to the child turning 3, because once the child turns 3, that decision needs to be made. And if the child is found eligible, we want an IEP in place. So starting on their 3rd birthday, they can begin receiving those services. So that is definitely a timeline that we know teams are paying careful attention to make sure that this is happening in a timely manner. You can go to the next slide, please. Thank you. So just kind of a brief overview of what that child find process looks like. And we'll talk a little bit about the difference between why a child might be found eligible for early access and maybe not so for special education in just a minute. But that overall process is that first, the AEA will want to determine if there's information to suggest that the toddler, the child might have a disability that requires special education. So that's the first step. It's often called suspicion of disability or disability suspect. So they'll take a look at the information that early access has to provide about, how the child's been doing while they've been in early access, as well as gathering information from the family as well to make that determination. And if the AEA does determine that, yes, we do suspect a disability, they will next ask the family to consent to an evaluation. And that is an important piece, again, where the parent will sign a consent that says, yep, I agree to have my child evaluated to see if they are eligible for special education. Once that is signed, then the AEA goes forward with the special education evaluation, and they will conduct that to determine if the learner is eligible for special education. The family is involved in that. So again, the team will use information from early access in that process and may also determine that they want to collect additional information. They will want to talk to the family to kind of have that full picture of the child and how they're doing at that time. Once the evaluation process is finished, then the full team comes together to discuss the results of that evaluation and make the final determination if the learner is eligible for special education. If they are found eligible, they move on to that 5th step, which is then developing the IEP, or the individualized education program, that will outline the goals and services that the child will receive once they turn 3. If the child's not found eligible at that time, then they kind of move over back to that other path that Dee described earlier, where there are other transition activities, and having those discussions around, okay, they're not going to move into special education, but what other resources are available in the community to continue to support the child and the family? So that's where we kind of have that kind of split in path, but you might start on one and move over to the other one, just depending on how things move forward. So we get a couple of frequently asked questions when talking about this transition process, and this one comes up quite often. And so we wanted to talk a little bit about how this might happen where a learner who's been eligible and receiving early access services goes down that path of trying to find out if they are eligible for special education, and ultimately the team may decide they're not. So how does that happen? And it really comes down to different requirements of eligibility between the two programs. And so as Dee, and I don't know, Dee, if you want to talk a little bit more about what that eligibility requirements are in early access, and then I can talk about the difference in special education.
Okay, thanks, Betsy. So in early access, the IDEA allows every state to define the developmental delay in regards to percent delay. How do they define that? In Iowa, when we were defining our developmental delay definition, we really wanted to be broad. And so we wanted to make sure that we were doing what early intervention was the purpose of that, and that's to intervene early to prevent the need for special education services in when the child turns 3. So by definition, we have said it's a 25% delay in any one area of development for the first part. So if a child's showing developmental delays um, of that nature in their thinking and their reasoning skills, in their physical motor development, in their communication skills, any of those social, emotional, and adaptive is kind of that self-help kinds of skills, then we want to make sure that they've qualified and they receive those services. Along with that, then Iowa has a list of many diagnoses that automatically qualify a child for early intervention, early access services. Again, that we always look at that list to make sure it's up to date and research based in regards to conditions that would lead to potentially a developmental delay. We work with our early hearing and detection program. So if a child is diagnosed with a hearing loss, um, even before like 3 months of age, we are providing services. We're offering early access services. If a child is born preterm, we want to make sure that they are automatically eligible to receive those services. And as I said, there's a list of a variety of different conditions that you don't have to show a developmental delay. You would automatically get those services to until the child turns 3. So a little different in regards to our definition. Okay.
Thanks, Dean. I think that's important. That's an important distinguishing piece where Dee kept saying automatically eligible, automatically eligible. They have this diagnosed medical or physical condition, and it's an automatic. And in special education, that's one of the big differences is they may have a diagnosed medical or physical condition coming out of early access. But the difference in special education is they also have to have a need for services. And so you can see on the side of the special education, and again, this is law that applies to ages 3 to 21. So when they move into special education, we're really talking about ages 3 to 21 and having that kind of double, piece to it. It has a disability and a need for services. So a couple of the questions that the team will look at to determine that is if they do have a disability, is that disability having an adverse effect on your child's ability to participate and benefit from age appropriate activities? And then does the child need special education and related services? And so there is um, occasions where a child may have a diagnosed medical disability, but they don't have a need for services. And that could look like maybe they just need an accommodation to access something, or maybe they just need, a piece of equipment that once that piece of equipment's in place, that's, all they need to be able to access and benefit from those age appropriate activities. And so that's where kind of that two-prong approach comes in, that teams will be looking at both, does the child have the disability and then the need for services. And it's important that families also understand that when the team comes together to make that decision about eligibility for special education, and the family doesn't agree with that decision, families can exercise those procedural safeguard rights. And so even though the eligibility decision was no, potentially they're, the team said, nope, they're not eligible for special education, you are still protected under those procedural rights if you don't agree with that decision. So that's a little bit about why we sometimes see that kind of transition from early access into special education having a difference in that eligibility requirement. Another question that comes forth sometimes is that if that happens where the child does not qualify for special education during that transition process and during that meeting, and so then the family's kind of moved over to that other path and they're talking about, okay, they're not eligible for special education, but maybe they're going to attend childcare. They're going to go on to other types of programming. And, you get into that programming or you get into that setting and some concerns come on, right? So the family starts to see or starts to feel like, gosh, I'm still really concerned. I'm not sure, we decided they weren't eligible. What do I do now? And so I think it's important to note that just because they maybe weren't eligible at that initial transition meeting, it doesn't mean they never will be. Right? So if you have concerns about your child's development at any time, whether that happens when they're 3 or maybe even further down the line when they turn 4 or 5, you can still reach out to the AEA or the school district, and request an evaluation for special education. Even if one had just been done and maybe it's 6 months later, a year later, you can ask for that again. And when you do, that child find process is triggered. And so there's kind of two ways it could go. The AEA and school district may respond and say, we don't suspect there's a disability here, and provide you with a prior written notice. And again, then that triggers your ability to exercise your procedural safeguards if you do not agree with that. Or they may say, yep, we do suspect a disability, and ask you to sign consent for an evaluation and do that evaluation process again to determine eligibility. So we just want families to know that even if that determination is made when they turn 3, that doesn't mean, from now on they can't ever access those services. There is a possibility that later on they may be found eligible. We know young children develop in varying rates, and so sometimes later on that may be an appropriate process to go through.
Betsy, I put a slide here, but I'm going to skip over this one and come back to it
You bet.
because I think that this maybe makes more sense this way. Okay.
Okay. So if the child is found eligible, then they continue down this path on the left, which is then it is the IEP process. And so what will happen next once they are found eligible for special education is the team will then meet and write an IEP, or individualized education program, for that child. So they will talk about what are the special education services and supports that are needed. They will write goals. They'll talk about related services as well. And there will be continued ongoing collaboration, communication, and support as everyone adjusts to those new setting services and programs. And so there are, different options and different services that may be provided. And we're not going to go through what all of those are now, but I would suggest that we did do another webinar a couple weeks ago that kind of talked about, yeah, if you want to go to that one, um, a little bit more about, well, what do services look like when they turn 3? And what are those options? So there's a little bit of information here about, early childhood special education is the required services that are provided under IDEA for children who are ages 3 to 5 and are provided in partnership between the local district and the AEA, and sometimes involving community partners as well. So I'll just say maybe if you get a chance to watch that other one, we talk more specifically about the different types of services, where those might be provided in that other webinar, so that you kind of have information going into that IEP about what are the possibilities. So if you want to go back. Perfect. So once the IEP is written, then the last step is to put that IEP into action. And again, by law, that needs to happen by the time the child turns 3. So on their 3rd birthday, the IEP should be written, and the parents have provided consent to that IEP. So the parents provided consent when they first did the evaluation, but they also have to provide written consent to that initial IEP. So that's a consent for special education related services. And the AEA and district will work with the family to ensure that smooth transition into that new programming. And then that IEP is implemented as written, and that team will continue to meet moving forward. So there's different requirements around what that looks like, but you review progress, you'll make adjustments to that IEP as needed, and at minimum, annually, every year, the team comes together to write a new IEP. So Dee, should we go back to that one? So we did want to do one slide that kind of highlights a little bit of the differences in the language and in the services that you may see as you're moving from early access to special education. So just a couple of highlights of what looks different. Those terms start to change, and the goal of those are slightly different as well. So I'll let Dee start with IFSP on the early access side.
All right. And I had mentioned a couple of those, the individualized family service plan and the natural environments. We also write, as a part of the family service plan, we write potentially child outcomes as well as family outcomes. So there are 2 different types of outcomes that the IFSP team will be working on. One involves what is the family wanting and services and supports to enhance their child and their development, as well as then there might be child-focused ones on, okay, well, this is the development we're focusing on. As I mentioned, we talk about our interventions in the context of those routines within the family's day, and then the other thing is we will always have a service coordinator walking alongside the family as a required service.
And so then as the child's moving into special education, some of the things that you'll start to hear that are termed a little bit differently. First is the plan itself. In early access, as Dee mentioned, it's called an IFSP, but once they turn 3 and from there forth on, it's called an IEP, so Individualized Education Program. They both have very similar intents. It's to outline, what are the services and supports, what are the goals, how is the child doing presently, where do we want to, where are we aiming for? What does all of that look like in one written document? And it becomes the legally binding document for all of those who are providing those services. So the intent of the documents are very similar, but there is this kind of switch in language that we know sometimes can be a little confusing. Another piece that looks different, so Dee mentioned natural environments, and that there's this prioritization in early access to serve the child wherever they are. And in special education, there's kind of this switch to a term we call least restrictive environment. And so it's really looking at what environment can we provide these services in that is the least restrictive. So as much as possible, they are with peers of the same age and receiving those services alongside them. In the preschool realm, this gets a little bit tricky, I will share, because preschool looks different from district to district and in our state versus other states. So we know this kind of age 3 to 5 gets a little bit tricky because there may not be the exact same model of preschool in different districts. And so that's where the team really has to come together and say, okay, these are the services and supports that we know this child needs. So what are the options in our community to provide that? That may be the school district's preschool program if they have one, and that's the appropriate place. There are other options in preschool, though. If there's a Head Start, that may be a possibility. If there's a community partner that provides preschool, that may be a possibility. There's some different requirements around that, but there are, again, and we discussed this a little bit more in that other webinar about what does that look like and how do teams come together to discuss that. But that is, again, a term that's a little bit different from early access. Another term that you'll see kind of a switch in, as Dean mentioned, with early access, they have outcomes that are for the child as well as the family. In special education, they're called goals. Again, they're similar in the sense of they're writing a statement of what they want the child to learn and be able to do at the end of that particular year or IEP, but they are focused on the learner or the child. So that is a difference where the family may see, okay, there's no longer going to be goals that are specifically for the family. They're going to be for the learner themselves. Now, that doesn't mean there might not be discussion of how to support the family, but there won't be specific goals for that. As far as the family guided routines-based intervention or that model of delivery that Dee spoke about, it switches in special education. We start talking about specially designed instruction. So what is the instruction or the strategies that the IEP team will use to help the learner reach those goals? So again, it's kind of the switch in language and a little bit different because usually those strategies are going to be applied within the context of a classroom or a regular early childhood program environment. And then the last piece that we wanted to highlight as a difference is in early access, that service coordinator, again, is really that central person that's helping the family, connect to all the different resources. In special education, it is usually going to be that teacher of the classroom where the student's going to attend who will facilitate those IEP team discussions and really help the family navigate, along with a full team. There is a full team of other potentially service providers who are involved as well, but we just kind of wanted to show, there won't be a service coordinator involved, but that teacher typically is the kind of that go-to person if the family has questions or thoughts about what's as part of the IEP. Anything else, Dee, that we wanted to highlight here?
I don't think so. I think that really leads us into the conclusion of really talking about, I'm sorry to be flipping, that the conclusion really is to ensure that smooth and that seamless transition for families, for children, as well as really for providers, both in early access in the community as well as in special education, is so that everyone has the information they need to provide those services. So what we really wanted to do is, I think that there's been potentially conversations in the chat, but we would like for you to be able to have an open mic to share your experiences, ask questions, ask the experts, which I'm not sure we're the experts, but we will give it a shot.
Yes, thank you so much for this presentation because I think it's going to be incredibly helpful now for people that are here and to be shared out in the future. I think everyone that responded, for the most part, it looks like we have providers, but I know some of the providers are with early access and some are not. So we'd like to still give you an opportunity to drop things into the chat if you do have a question. I know Sarah and I have kind of brainstormed some more questions that we've received from families. If that's okay, I'll ask a couple of those while I'm thinking of it, and then we'll see if anybody else comments in the chat. So I know one question that we get, and I know you kind of touched on the reasoning to this, but maybe if you could just help clarify. I know one question we often get is a family maybe really has a hope that their child, if they do qualify for ECSE, will go to a certain school or go to, they want them to go with their other child at a, that is in the neighborhood school or something. And I know sometimes that happens and sometimes that doesn't. And so I wondered if you could maybe speak to that for us.
Sure. It's an IEP team decision, but there is a piece in IDEA that does talk about having the child attend where they would attend if they were not identified as having a disability or eligible for special education. So really starting with that location first. So for example, if the child maybe were already attending preschool, and that might not necessarily be the case if they're transitioning out of early access, but maybe if they're being identified later on and they're already in a preschool setting at an elementary building or a district building, then the team will start with that setting because that's where they are. But if they're not, and there is, a desire for the family to have them go to a specific location, it's on the table. It's always a discussion with the team as far as what that looks like, but the team has to first determine what are the services and supports that are needed, and then depending on what those are, what is an appropriate location, because it may be the case that a specific location isn't able to provide what's in the IEP. So there's a lot of different variables that come into play with that discussion, but we definitely encourage family to bring that forth when they're at that point in the discussion with the team to say, hey, I have siblings who attended this elementary. Is that a possibility? And that's where the discussion can start. And then it always again comes back to what are the needs for that student and what's the right match between the two. So Dee, any additional thoughts on that?
No, I was just thinking, we also had a webinar earlier about Head Start in collaboration with Head Start. And so that would be another, conversation with children or in communities that have early Head Start and they're moving to, or they've applied for Head Start during this process. Then, as Betsy said, those conversations we would be talking with our Head Start partners as well to think about being a part of our team and talking about that. Where would an environment be in order to help support a child's services?
Thank you. Looks like in the chat we have a question that says, can you speak to the district's obligation to provide services to a child and choosing their district program versus a community preschool?
Yeah, okay. Great question, and this is one that we know comes up quite a bit. There's some requirements around using community preschools or community partners as a potential location for receiving those IEP services. So that is one of the first things that often either the district or the AA will communicate with the family. So we do have some requirements around those settings have to meet program standards. And there's potentially some licensed teacher things that come in there as well. So that can be kind of one of the first things that we have to look at, because if that community preschool is not meeting those requirements, unfortunately, that kind of takes it off the table as an option. But if they are, then it really does, again, come down to what are the child's needs, and then where is an appropriate location for that to happen. Now, I will say that if there is 2 equal locations available, one is in the district and one is a community partner, the district can say, you know, we're going to provide that here in our district program, because they are the ones who are responsible for providing that IEP if all else things are equal. But we do encourage the teams to have a discussion, that's not an automatic coming into that meeting, that we really explore what the options are. And, you know, especially if the child's already attending somewhere, really thinking through what the effect may be to pull that child out of that setting, and place them somewhere else. Is that increasing transitions? Might there be some issues around that? So again, it's hard to say because there's lots of variables, right? Then there's the transportation question, there's staffing, there's all of that. So it's a lot of different pieces, and we really ask the AEAs and the districts and the families to come together to discuss all of that before making that final decision. See anything to add there?
I don't think so. I think you've covered that.
Yeah. Thank you so much. Another question that we had, and forgive me, I know Sarah and I were monitoring the chat, so if we missed this, just tell me. One thing we were wondering is, I know you spoke to if a concern does come up from the age of 3 to 5 after they've exited out, that they can reach out to the school district or to their local AEA. And we just wondered, what's the best way for them to contact their AEA if they chose to do that, or find who they contact?
I think we included a link in the other webinar about like find your AEA. So if you're, I mean, if they're coming out of early access, they're probably very familiar with who their AEA
Yes.
is, unless they
Okay.
moved to a new area.
Yes.
But it'd be reaching back out to that same AEA,
Okay.
and each AEA has, you know, different folks as far as who to contact. But I always just suggest start with the main office, the main number, and they'll get you to who that needs to be. And I think it's just important to say, you know, I'm concerned about my child's development. If they really are looking for an evaluation, to speak that and say, I'm seeking an evaluation for special education, so that it's clear what you're looking for. If you're looking more for just what are options, then expressing that as well. So again, and you can do that once they turn 3. You can also do that through the school district. So either one should get you to onto the right path.
The only other thing I would say is, we have a strong collaborative partnership with our early childhood community providers. And so many of the area education agencies, they may already have a relationship with the local preschool programs. And so it would also be, something that if the teacher of a preschool or a childcare environment, if they talk with the family and the family talks with the childcare provider, they may already know exactly who to contact because of that
Mhm.
relationship. So, um, there we do have a lot of partnerships in that regard in the communities. So,
Well, thank you. That's very helpful. Just a couple more. It doesn't, and then if anybody else has anything for in the chat, feel free to still drop something there. The last couple we had was just, I know you mentioned sometimes a child doesn't need an IEP because they might just need a modification, like a piece of equipment or something. And so if a child does fall into that situation, does the team help them get that modification, or what should the parent do in that situation? Do you have any advice with that?
I think that the team coming together will have some resources potentially to talk about. I'm hesitating because it also depends on when they move over to that other path, where are they going to go next? So, you know, if they're going to go into a childcare setting, into a preschool setting, or maybe they're not going to move to any type of setting. So it kind of depends on where they're moving into, and then what that need might look like, because there are many different community options depending on where you're located that may be available to you to help support that. So start with the team, and then I think they'll connect you as needed.
Okay.
Yeah.
the other part of that, I think about the service coordinator is there as
Mhm.
well to help support that transition.
Yeah.
And so if that is the situation where, the child and family are not going to be in and receiving special education services, it might be a time where the service coordinator, again, provides that support or tries to reach out to other community services that might be able to support the implementation of some of those recommendations. So I would say lean on that service coordinator as well. And, we talk about transition of the beginning or the ending in the middle and then the beginning of something new. And service coordinators are really, we talk about staying with the family until that really kind of that transition process has come full circle. And so just because the child turns 3 on that birthday, the service coordinator potentially could ease out of that transition process by supporting that next environment to better understand what's going on with the family and child. So
Thank you so much. I think you have answered all the questions that Sarah and I could think of, and it doesn't look like we have any more in the chat. So I just want to thank you again to Betsy and Dee for taking time today to come and speak to this topic that I know is going to be really helpful for our families. Don't forget to like and subscribe to our YouTube channel and to find us on Facebook for daily tips and information. And thank you for coming and have a great day.